This meeting is being recorded.
Hello, everybody. Welcome to the April Spiritual Care Network webinar with Walter Wolf. We're going to be starting in just a few minutes. So in the meantime, please put in the chat where you're from and where you work. We'll be starting shortly.
Hey, you're getting people.
Yes.
Yeah.
It's a great topic. We are also going to go live on Facebook. So if you have to get out early or your friends miss it, you can direct them to the Spiritual Care Network Facebook page and share that with everybody.
Yeah, you do have a Q&A.
Yes, so everybody please use the chat box to announce who you are and where you're from. We do have a Q&A box at the bottom. We can use that throughout the presentation, and Kim and I will be glad to filter those through and interrupt him right in the middle of his thought and see if we can throw him off. How would that be?
That's not very difficult to do.
Well, looking forward to the presentation today, this Good Friday. Looking forward to a nice Easter weekend myself. How about y'all?
Thank God it's Friday.
Good Friday.
And it's Good Friday. I'm surprised all these people are working today. I'm impressed. I was a little worried, that with it being a Good Friday, we weren't going to have a lot of participants, but we're pulling them in. So this is good news.
Yeah, from all over Texas and even outside of Texas. Well, great. Well, so for those that are on that want to know about past events or webinars or what's going to come up, we have some really good ones throughout the summer already scheduled. Thanks, Kim. Please go to our website at spiritualcarenet.org. And we actually will post this one, and you'll also find our other ones that we've done the last 2 years. We've done a lot since quarantine changed the world of how we meet and CEU presentations. So great presentations posted on our website, and also events and conferences and other great information on our Facebook page. Speaking of conferences, we're excited to announce on June 3rd, that's a Friday, in San Antonio, we'll have the first Hope Rising Conference in San Antonio. We're also looking at doing one in Memphis in July, I think July 27th or 28th. And then again in the Woodlands in January, on January 27th. So look for those exciting conferences to come up. We have so many awesome industry experts that are going to be speaking. Some of these are going to be open to the public as well as professionals in the industry to come and get your continuing education and just kind of bridge that gap between mental health and faith. So we appreciate that. And there's also information on our website about joining as a member, either as an individual or a corporate member. So my name is Eric Ailes. I'm board president of the Spiritual Care Network. I also work at Starlite Recovery Center, located in Center Point, Texas, Drug and Alcohol Treatment Center. And I know Kim is also works for a drug and alcohol rehab, and we are really excited about the topic today. Aren't you, Kim?
Very excited. Hi, everybody. I'm Kim Livesey. I live here in the Houston area. I represent La Hacienda Treatment Centers and own a women's sober living here in Spring. I work with Eric quite often, have for a while, been a good friend of Spiritual Care Network, and I love to help him find really great educational speakers that will speak to us as therapists and people that work in different churches and or spiritual organizations to help us bridge the gap and understand the resources that are available, which led us to meet Walter. Walter Wolf is the author. It's his pen name. I did meet him by his other, I guess, real name, Neil Nordlinger. So I may go back and forth because that's how my brain works. but we are really excited to have him here today and learn more about his book entitled The Right Rehab. We also, just real quick, have some other speakers coming up in the next few months. Looks like in May, third Friday in May, we have Helena Washington. She's a good friend of all of ours. Real excited about Helena. Don't have her topic yet, but we will, and we'll be putting that out there to you guys to let you know what her topic is. June 17th, we have Stephen Wright, Grace Program Director at Timberline Knolls. And July 15th, my friend Sarah Gallup, who's an LCDC LPC here in the Houston area, is going to be our speaker and presenter. If any of you guys feel, if doing this type of presentation is something that you are interested in trying to do, please feel free to reach out to me, and I will put my information in the chat so that y'all have my email. And yeah, I'm just super excited to hear from Walter today, learn more about this book, which obviously I need to get the book. that's where I need to start.
Everybody
Yeah.
needs that book.
Yeah.
Well,
I thought you read it
begin,
twice by now.
Yeah. Bestseller here.
I will.
Well, before we begin, let's start with a word of prayer. Dear Heavenly Father, just thank you for this presentation today and bringing together these professionals to learn and to grow and to bridge that gap between mental health and faith. And we're just so thankful for what you're doing with the Spiritual Care Network and how you're growing it. And just bless us, and thank you for sending your son as we celebrate Easter weekend. In Jesus' name we pray. Amen. Okay, we're going to turn it over to you, Walter.
All right, let me get the share going.
I think we're already sharing the screen there.
Can you see my screen?
Yes.
Perfect. Okay. Well, first of all, thank you so much, Kim and Eric, for inviting me to do this. I'm very excited about meeting your group and being in front of them. So thank you very much. I do want to say I do encourage people to interrupt me as I'm going along here. And I understand the best way to do that is to put any questions or comments you have is to put them in the Q&A section of the discussion. And that way, either Eric and Kim can let me know, hey, this is so-and-so would like to know this. So I would really appreciate that. Well, I'm here for reasons that over which I had absolutely no control whatsoever 13 years ago. And that is that I got that call at 3 a.m. And the call was that my son is in crisis due to addiction. And it's something which his mother and I had absolutely not a clue that this was happening. And once I hung up the phone, I mean, I won't tell you exactly what I said to myself, but it was in the sense like, what the hell do I do now? What do I do? Because I knew absolutely nothing about addiction. I knew even less about treatment. So I was like most people. But fortunately for me, I had a friend who did know. And so I called him at 5:30 in the morning. This is in Los Angeles. I'm from LA. And I call him up, and what I could say is because he had, and I say was because unfortunately he passed away 4 years ago, but he was a very well-known guy. He was a celebrity. He was a really well-known actor and bestseller, New York Times bestseller. And he was very tied in with the Los Angeles recovery community. And he and I had grown up since we were both 12 years old. So within 24 hours, my son was in detox at one of the finest facilities in the nation. And I started thinking, well, I was lucky, but what about people who aren't as lucky as I am? What if they don't have a Chris to call and say, hey, what do I do? So I started looking around also for any type of material that was out there that could tell me what are the steps you need to take when you have somebody in your family or yourself or a loved one who needs to go to treatment. And there was none. But one thing that I did know, and that was that my son, like as of today, back then, but the numbers today are that he was simply one of 74 million people in our country who are suffering from mental disorder and or substance use disorder. That's 74 million people over the age of 18. That's 29% of people who are over the age of 18. Now, what does that equal? Let's put that in context. That's the population of California, Oregon, Washington, Idaho, Montana, Wyoming, Nevada, Utah, Colorado, and wait, it's coming, Arizona. That's how many people in this country are suffering from mental disorder and or substance use disorder. And so it's bizarre when you put it in that context. Now, during this whole trip, during this whole time that I've been since 13 years ago, I was slowly pulled into helping people because I started getting phone calls, and people would call me and say, "Hey, Walter, I heard about your situation with your son. I have the same problem. What do I do?" So then what I started doing was, because of my relationship with Chris, his name was Chris Lawford was his name. And what people Chris introduced me to the finest people, I think, in your business, in your world, especially people of the highest ethics. And I started helping people get into the right facility that matched them. So I started to learn what it takes to do that. So I really fell in love with this. So what happened was I decided to stop doing what I was doing at the time, and I'm doing this full time. And I'll get into a little bit later as to exactly what that is. But during this journey, I have learned 7 key lessons. One lesson is 16,000. And what that is that's the number of facilities in our nation, according to SAMHSA. Now, when you hear people say, "Oh, why don't you send him or her to so that place or to this place?" Very little. These people don't realize that there's 16,000 treatment programs in our country. You just don't send somebody to somewhere because you hear it's really good. That is, and most people have no idea which is the right facility for your son, your daughter, your spouse, or even yourself. People simply don't know. And then the figure 42 billion, that's $42 billion. That's how much money is spent every year in the treatment industry. The key is that how do you stay away from the grifters and the scammers who will do everything in the world to separate you from your money? And I'll tell you, I can't tell you how many times I've heard people say to me, "My God, I wish I knew you 6 months ago," or "I wish I knew you a year ago." And more or less the reasons why people decided to go where they did send somebody and they now regret it is, well, the one expression I hear all the time is, "It really looked good on Google." And then people, they fall into the traps, which we'll get into in just a few more slides down the road. Now, I know that all of us here and everybody we know, we really all try to be the perfect family. And this is the second lesson I've learned. But you know what? I've yet to meet one. And that's because most of us are really like this. I don't care who you are. I don't care where you live in this country. I don't care where you are on the socioeconomic ladder here. Said every family has issues. Every family. And the question is that people really need to answer these families is, one thing that they have to understand, I should say, is that even though one person may be, let's say, addicted or suffering from mental disorder in the family, it does affect the whole family. That person didn't turn out to be the way he or she is because it's just one simple individual. It's the family that is also ill. So what I have learned is what's incredibly important is that the family has to understand that, and that's why family behavioral therapy is remarkably important. That's why I like to send people to facilities where they at least have once a week a video conference between the individual's therapist and the family. And I will say most of the time, it's the mothers who really, are motivated to do it. Fathers sometimes can be really difficult to admit, like, yeah, we got some issues, but It's difficult to get them involved sometimes, not all the time. The third lesson that I learned is that addiction is a chronic brain disease. That causes the inability to control the impulse to use a substance or stop repeating a process despite devastating consequences. Now, what I always have to explain to people who don't know what you know, okay, and by the way, I'm not telling you anything you don't know. I realize that. I'm a father of a family with somebody who's in recovery today, thank goodness. So this is my credibility. It's not, I don't have the letters after my name. So probably everything I'm telling you, you probably already know. You most likely already know. But I have to explain to people that addiction, it's not the result of bad character or low morals. It's a combination of genetics and environment. And a couple of the genetic and the environmental factors would be, for instance, trauma or neglect, family history of addiction, household instability and available of drugs or alcohol, incarceration of family members, age when use begins, and especially co-occurring mental disorder. Now, fourth, when we talk about co-occurring mental disorder, I know SAMHSA says that between 40 and 60% of people who are suffering from addiction also have a co-occurring mental disorder. For me, it's about 80%. And the question always is, well, which one is driving the other? And I have to tell you, diagnosis is more important than anything on this planet, as far as I'm concerned, when it comes to this. And I know that there has to be a diagnosis, but the diagnosis has to come from a licensed, certified healthcare professional. You can't go on a family member's hunch that this is what he or she thinks it is. That's where people like yourselves come in, and you have to have the education, you have the qualifications of saying, you know, what this person's diagnosis is and how this person needs to be treated. And I must say that most people don't know this, but there are two categories of mental illness. The one category involves all mental illnesses, and both these categories are mutually non-exclusive, but AMI, or any mental illness, is all mental illnesses, you know, from mental disorders that from no impairment to mild to moderate to severe. And most of the people today, I mean, you consider that 46 million people last year went to mental illness treatment, whether it was in group therapy or whether it was an individual therapy. 46 million people over the age of 18. That is encouraging. That is really good. But my point is that a lot of people, most people have a mental illness, and you would never know. And that's because of today's attitude about people doing something about it, but also medication. So there are a lot of hopeful signs out there that, you know, eventually people are starting to get enlightened that, hey, I have an issue. I have the ability to do something about it, and they actually do. Well, the other category, unfortunately, is serious mental illness, or SMI. And that's an illness that substantially interferes or limits one's major life activities. And the acute forms, of course, would be acute forms of schizophrenia, personality disorders, and so forth. We all know what those are. But fortunately, most of the people with mental illness are with one that's eminently treatable and one that doesn't necessarily interfere in one's life. Now, the other lesson that I've learned that has been incredibly important in what I'm doing, and that is that resources don't get the individual sober. Resources, they help provide the tools for getting sober. So ironically, well, not ironically, but the more money one has, the more tools that are available to you. The less resources, the less money one has, the fewer the tools. But that doesn't mean that you can't have effective treatment. So, for instance, I can go ahead and send somebody, you know, somebody could spend $240,000 for 3 months at a Malibu rehab, okay? Or they can get it for free at a 12-step meeting in a church basement. My point is, just because somebody may have a lot more resources, it doesn't mean that that person is going to get into recovery versus somebody else who doesn't have the resources. We all know people who have been to rehab several times. And we also know people, I know several people who have had decades of recovery and they have never set foot inside a residential facility. Because for a lot of people, it's 12-step, it's outpatient therapy. There's nothing written in stone that somebody has to go to a residential facility. A residential facility is great for people who are motivated to get sober and they need the tools that they can learn from evidence-based treatment. A lot of people need that, but there are people out there who can do it other ways. So there isn't one uniform way of doing it. And finally, well, not finally, but six, I have to let people know with whom I work all the time, relapse is not failure. You consider that 60% of all people who go to treatment, they relapse within 1 year of discharge. So I always tell families that relapse is frequently part of the journey. And so I have frequently heard people say, well, there goes all that money down the drain when we sent so-and-so to that facility. Well, what good did that do? Not true. What relapse means is that whatever had been working before is no longer working now. And what needs to be done is you need to pinpoint what that is that's no longer working and then tweak it and adjustment. Does it mean sometimes that you have to go back, to residential? Yes. Does it mean all the time? No. It all depends upon the individual and how the individual fits with a particular treatment plan. And finally, there is no such thing as the best rehab. I look at Newsweek and I hear, no, Sierra Tucson is a fantastic facility. And I know it's owned by Acadia. It's a fantastic facility. I've been there, but Sierra Tucson is the best facility for the person who best fits Sierra Tucson and vice versa. So I firmly believe there is no such thing as the best facility. There is the right facility for the right treatment for the right individual. I maintain that I don't care whether you live on Park Avenue or if you're living in a homeless shelter, there is a treatment plan for you. And my point is that it doesn't matter what your resources are or your lack thereof. The key in getting onto a plan where you can reach recovery is up to the individual. I have seen it myself. The individual has got to really want to surrender and want to get and stay sober. So my point is that when it comes to treatment, in my experience, okay, one size does not fit all. And one of the reasons that one size does not fit all when we're trying to find the right rehab is diagnosis. Most people don't realize this. When I explain this to people, they're actually kind of shocked. And that is, there really are 4 diagnoses, as you know. There's mental illness, there's substance use disorder, then primary substance use disorder, secondary mental disorder, and then primary mental disorder, secondary substance use disorder. When I explain that to people, what you have to do is you have to send somebody to a facility whose diagnosis matches that facility's licensure. And once you can figure out, a list, or what I do is I always come up with 4 or 6 or 8 facilities that not only match that licensure, licensure matches the diagnosis, but also the diagnosis, the treatment that facility is offering also matches that particular, not only diagnosis, but all the personal factors with that individual as well. So, but here are a few things which I always counsel people to avoid of what not to do. Don't call toll-free numbers when you're watching TV ads at 2:00 in the morning. Okay. Don't go to a website, don't go to a rehab because they have a very nice website or they cold called you. And especially be careful stay away from facilities where the salespeople, the phone person in a boiler room, where they say they treat everything. no place treats everything. And if they do, it can't be any good. Stay away from body brokers because they really don't care about you. They only care about getting a commission from the place where you end up going. And not only is that illegal in some states, but it's the most unethical thing that you could ever have happen to you or be a part of. Stay away from, my opinion, places that offer to pay for your airfare. Not all the time, but most of the time. They obviously only give you one way, but most of the time it's one of the tools they use in order to get you there under any circumstance. Because I realize when you're working in this business, you've got a lot of competition. It's very difficult. I don't know how you all do it in terms of getting people to come. It is so difficult. I would be the worst at it. That's all I can say. And but my hat's off to you, because you really, I mean, the people on this call, and I know the people I know here, I really admire you. I really admire you. And also, you've got to make sure that a facility confirms that they are either in network or out of network, and always get the cost in writing. Now, when it comes to a treatment plan, it's been my experience that a 1-year treatment plan that was not devised by me, by the way, but it's been devised by professionals in your business. But I have found that, and one thing that I do with the facility, by the way, we will put together a 1-year treatment plan for an individual. And the first stage of it is the treatment. Well, the treatment obviously has to be per the diagnosis, the individual's drug use patterns. What are the different medical issues involved with this individual? What are the social issues? And what kind of resources does that individual have? Is it going to be private pay? Is it going to be insurance? Is it going to be a scholarship? Is it going to be public assistance, or a combination of any of them? And then hopefully that person is going to be able to get into a 90-day program. And because we know that experts say that anything less than 90 days of formal treatment is not quite as effective as the treatment that one should be getting. And that 90-day treatment obviously is going to include evidence-based therapy, residential, if the person's resources will allow it, outpatient therapy, MAT, medication assisted treatment, if that individual needs it. But it also is most effective when it's also in congruence, when it's also with therapy, not the medication by itself, but it's medication along with evidence-based therapy. It has to include transitional living, and of course, meetings. I can't overstate how important meetings are to the people with whom I have been working. And it doesn't necessarily have to be AA. There are other 12 other support groups as well, but obviously AA is the dominant one. And as far as I'm concerned, AA has saved so many people's lives. It's remarkable. And then finally, after 90 days, the balance of the year would be 9 months of RSS, which would be recovery support services, which of course would include sober living, MAT meetings, private and group therapy, of course, get a job, go back to school, get involved with community service, and of course, life skills. You know this better than I do. The people who don't know how to budget, who don't know how to go grocery shopping. I mean, it's like people have to learn either all over again or learn for the first time how they can live the most productive and fruitful and life that they're able to live. So 90 days, I explain to people that this is what 90 days is really all about. It's about, the first step being detox. I know if needed, but I also know most facilities, whether a person needs detox or not, they will hold that person in there for 24 hours just for observation. But most of the time, somebody, if they do need detox, it's 3 days, 5 days, 7 days, depending upon the substance from which that person is detoxing. And some places like to include detox in the 30-day residential stage. A lot of places don't include detox. Nonetheless, the first 30 days I explain to people is detox and residential, and then PHP, partial hospitalization, and then IOP. But during this whole time, if one needs MAT, that can start on day one. Meetings start on day one. Sober living conventionally will start, when one goes into PHP. And of course, as of day 60, when one is IOP, that's the time to really start transitioning into the real world in terms of a job and education, for instance. Now, one of the biggest issues that I find in what I do is how does one pay for treatment? Now, when it comes to private pay, this is a beautiful plan. And people who have the ability, the people who are lucky enough to be able to have the resources to do private pay, this is the plan they normally follow. Unfortunately, when it comes to insurance, it's a lot more difficult. I will say that getting 90 days of treatment that's driven by insurance is a pipe dream. In my experience, it never happens. What usually happens is you detox and residential, I've never seen, except for sometimes an adolescent, I've never seen an adult get 30 days of residential out of insurance. I have never seen it. And then when they transition to PHP, I've never seen them get 30 days of PHP and IOP. Basically, in my experience, if you get a lot of times, if you can get 30 days of residential and PHP together, that happens a lot. You're really lucky if you can get 35 or 40 days. Sometimes it'll be 45, but I've never seen, and I'm more than happy to be wrong. If anybody on this call thinks that, well, Walter, you haven't been to so-and-so, I'll take that. But I've never seen anybody get 90 days. And part of the problem is that, let's take residential as an example. Private pay. Private pay, of course, you can get full 30 days of residential. And in terms of residential with insurance, well, of course, we know that you all who work at facilities, you know that it's totally out of your hands as to how many days that the person is going to get authorized treatment from the insurance company. We know that. And because of that, that's because the insurance has complete control over the authorization, not only how many days, but also the kind of treatment that person is going to get. So that when I deal with a facility and when I need a VOB, a verification of benefits for someone, I always ask the question, tell me, what is the recent history of this facility and this particular insurance carrier? And I know that you all cannot commit as to how many days, but I usually do get a range of days. Well, we think it's going to be between 6 and 18 days, whatever the range may be. But I know that you all are in a really bad position because you know what the person needs, but you've got one hand tied behind your backs. You cannot guarantee how many days that person is going to have. So, and I know that you have to have a UR, every 3, 5, 7, 10 days. They put you through hell in my experience. I had one experience where I sent a client to Betty Ford, and the person there said, Walter, you can expect, based upon our recent history with Blue Shield of California, you can expect 18 days. So I know that's not a commitment, but I was hoping, I told my client, so-and-so thinks we can get it. Don't count on it. But, well, imagine my surprise when she called me and said, well, I'm sorry, but it's 6 days. Blue Shield has pulled authorization. Well, that's unfortunately is not the only time that has happened. So that's a lot of times that's what happens with insurance, unfortunately. And so with residential, a stage that should be 30 days can be anywhere from 10 to 12, 15, 18, 20, or 22, or maybe 25 days if you're lucky. And then you slip over to PHP. And like I said earlier, you're lucky if you can get 35 or 40 days with PHP. One thing that I have to explain to the client is that when that person is out of RTC, out of residential, one of a few things can happen. I know facilities will keep that individual in the residential facility. That person will sleep in the same bed for 30 days, even though that person, the insurance company, stopped authorizing for residential, is now authorizing PHP. But I know facilities that won't change a thing. They will, and they keep that person in residential for 30 days, and then after 30, move that person off campus for, continue how many days of PHP are left. Also, but also I know facilities where most facilities, they will have to charge a housing fee. And that's understandable because they're now getting a lower reimbursement from the insurance company. Now, some facilities will go ahead and keep the person in the residential setting, but charge a housing fee, and that can be anywhere from 25 to 50 to 100. Sometimes Betty Ford was charging $167 a day, so it can go up to $200 a day. They will let that person stay in residential, but there are places like in California, there's a state law is that if somebody drops down to PHP, that person cannot stay in the same setting where he or she was during residential. So you have to have definitely two different facilities for residential, for PHP living and PHP therapy. So, and also I know facilities that ahead of time, they will charge you also a deposit. There's some places that will charge $10,000 up front because of they know that there's going to be a cutoff of the residential days authorization, and ahead of time they want to get the money for the housing. So when I talk to clients about insurance, they're still going to need cash. So the PHP housing, the deposit for the PHP housing, I also explain to them, you're going to have to pay up front whatever is unmet on your deductible and your out of pocket. If you're going to a facility that's out of network with your insurance, frequently those figures are twice, they're double your in network deductible, they're double your in network out of pocket. So there are a lot of, this is why people, when I work with people, they say, my God, I never could have done this on my own. And I can see, I can see why. I can see why, because they got enough to handle as it is. So now there's one last item that I'd like to discuss, that I'd like to say. And by all means, if there are any questions, please let me know. But I'm going
to stop you. I have one question, and I'm assuming this is okay to do this. It says, this is from Barbara Hall. She's asking if it's possible for you to give 6 to 8 of the best places for self-pay families.
I guess I get asked that, but unfortunately, I'm not trying to be difficult, but I really like to know the particulars about the individual, because it really depends upon what that person's diagnosis is. It depends on what that person's demographic is. It depends upon, obviously, the resources are there for private pay, but there are all kinds of other issues. So I could say, but you know what? I mean, I don't know. I mean, I really don't know. It takes a little, I have to have a discussion to find out more about the individual. I hate to be disappointing.
No, that's okay. So you're going to probably supply us with your contact information. So Barbara Hall, if I were you, I would reach out to Walter in an email or phone call. If you have,
I'll give you the information at the end of the discussion of how people can reach out to me. That'd be easy to do. But last thing that I don't know if enough people really know about this, but we have a problem in this country with underinsurance. And here we are. So right now, there are 166 million people in our country who have a health insurance plan through their employer. Unfortunately, 26% of those people, or 40 million people, are underinsured. Now, what does underinsured mean? Well, I'll get to that in a second, but I want to say that as far as the state of Texas is concerned, okay, most people who have health insurance in Texas, okay, have insurance through their employer. And that's 48.1% of all the employees. That's 6.3 million people in Texas. Now, in Texas, in 2020, okay, when the average worker is at what they paid for their contribution to the health insurance plan, plus the deductible that they have to pay, that turned out to be $9,300. And that turns out to being 14.2% of the median income in Texas, okay? 14.2%. Well, you know what? That's a problem because according to the United States government, anything over 9.6% of your income that goes to insurance, your out of pocket and your contribution, and of course your deductible, you are underinsured. And the median income in Texas in 2020 is $65,570. So there are a lot of people who have an insurance policy, but they can't afford to use it because of the contributions go up every year for an employee. The deductible is going up every year, and the out of pocket is going up every year. But here's something that should really scare you. Okay, the Millman Institute, they're a really fantastic institute when it comes to medical information and statistics. They have figured that for a family of 4, they spend all in over $30,000 a year that related to healthcare, of which 13,000 of it, okay, is their contribution to that 30,000, okay? And then you add another $4,500 that they spend out of pocket for pharmacy costs, okay? So you're talking about $17,500 out of the gate that one has to pay for healthcare when you have a PPO policy. That's a problem. And that's why so many people who need behavioral health treatment, they can't get it. So so the reason I'm saying this is that I want people to realize that there is a bill in Congress proposed by the administration to use the ACA to be able to subsidize people who have that type of insurance policy, so that as anybody whose costs are over 9.6% of their yearly household income, they can get help from the government, and in order to use their insurance policy. So I'm going to end up on that, and I hope people have learned something from this. But I do want to say I can't thank you enough for let me go back to the card where how you can get a hold of me. I can't thank you enough for doing what you're doing. And also I can't thank you enough for for listening to me. I very much appreciate it. And this is how you get a hold of me. Walter Wolf. The best way to get a hold of me is Walter at the Right Rehab. There's my toll-free number is 1-888-557-02-7474. And my website is therighrehab.com. You can also, as far as the book is concerned, I'm incredibly humbled by the testimonials and the reviews. You can see them all on my website, but you can also go to Amazon.com and type in The Right Rehab, and you'll see the book come up. You'll see all the testimonials and the reviews and everything that you need to see. And of course, you may order the book if you feel so inclined. The response has been remarkable, not only in terms of people like yourselves who have read the book and have been nice enough to write testimonials about it, but also I have people from all over the country calling me, especially mothers who say, Walter, I've read your book twice. I mean, and people are getting, I'm the lucky one, guys. People are getting, they're getting something out of it. And I give away all everything I know, any type of secrets I may have, it's out there in the book. And so people don't even have to talk to me if they need to find a facility. They can see what they need to find, and they can call you directly. They don't need to call me. The only reason why people would call me now is because I have that ability of I have all the relationships And I have, you know, instinctively now, because I've been to so many facilities around the country, said I have the ability of knowing which ones would be the right facilities, because I always bring up 4, 6, or 8 to every individual client. You know, because I've been doing this so long, that I do have the ability of knowing instinctively, okay, which are going to be the right ones for this person and that person. But in terms of what I do, it's out there. It's all there. So, and this has been an incredible journey for me. And it's remarkable how something which is tragic can turn out to be like, whoa, you know, the way that it is.
Well,
So,
and Walter, I know we're going to get this question. We usually do. Are you able to share your slides? We could.
If you want to use the slides, so be my guest.
All right. There's a lot of good information in there. Yeah. So we could post that on our website with a recording of this presentation.
Yeah.
You can listen to it over and over again.
Oh, well, I don't know whether to feel sorry for them or like say, hey, but either way, I say thank you very much.
No doubt.
Okay.
I have a question here from one of the people attending today, and then I've got a couple of maybe questions of my own. But I want to urge everyone that's listening now, if you heard anything in the last 30 minutes it was a lot of information, a lot of insurance information, which can be overwhelming. But if you had heard anything that you have any questions about, please feel free to put that in the Q&A or the chat, and I can relay that to Walter, and he can answer them. But one question, this is more of a statement, but a little bit of a question. And I relate to this person because I've worked in both arenas. I've worked as a therapist that's trying to help people get to treatment, if indeed that's, deemed necessary. And then I've worked for the treatment centers. So I'm going to try to be objective, but this question is, I was at Sierra Tucson. I found that the facility had a lot of support for trauma and substance abuse, but not exactly for eating disorders. So I guess what we're asking here is, it gets confusing when an individual does an assessment, let's just say a phone assessment, and the treatment center is not really transparent about what you talked about in the beginning when you said there's no treatment center that treats everything. So how can these therapists guide their patients into asking exactly the right questions and making sure that patient is getting the specific treatment for the specific diagnosis that they have? What are your thoughts on that?
Good question. First thing that has to be established is, what is the definitive diagnosis? Now, one way, if you feel like the diagnosis is not definitive enough, because we all know that an over-the-phone assessment is not deep enough. I mean, it's good as a first blush, but it's not deep enough to really find out what's going on with this individual. That's why I like to send people, when that is the situation, when I can't get a diagnosis, or we know that a diagnosis is not the right diagnosis, I like to send people to an assessment program. And there are some really good assessment programs around the nation. And when I say assessment, I'm talking about 5 to 7 days of an assessment at a facility, but it's an assessment program. And there's one in Rancho Mirage, which I really love, and they do a really phenomenal job as well. I mean, Cottonwood does a great job, Karen does a great job, and a place called Solution Point in Rancho Mirage, they do a phenomenal job. There are facilities like, for instance, Solution Point as an example, and I have no connection to them, by the way. I have no connection with any facility. I work for the client, okay? They have a 21-day program, and they really get deep into what's happening with that individual. And also Cottonwood is really good as well. And Karen is phenomenal. But what they do is, the longer you have somebody, the more deeper the assessment. And also you can really kickstart residential treatment. So the whole goal is first stabilize the individual, do a deep dive diagnosis, and then recommend the type of treatment that individual needs. And if it's me, we both work together to put together a list of the facilities that would be right for that individual. Now, I know for trauma, there are a few places that are really excellent for trauma, one of which is the Refuge, which is owned by Acadia. That's a remarkable place. So there are some terrific places for trauma if that's what really needs to be treated. And that's why, Kim, it goes to what I was saying in the beginning. There's no such thing as the best rehab. It doesn't exist. Sierra Tucson is a phenomenal place, but it's not great for everything, you know?
Right.
So go ahead. Yeah.
It's all about, you're correct. It really is important on the, the individual that's trying to help one get to treatment, to be as thorough as possible in deeming what needs to be addressed, and then doing a lot of homework and knowing your resources, which is, it's like you said, there's 16,000 facilities. So, I'm out there talking to therapists often, and they, they sometimes don't know where to start, or they have certain facilities that have become their favorites and they utilize those, because they're comfortable with those.
Yeah, of course.
And, and then trying to figure out what else is out there. And I can tell you, and so can Eric, that there is so many new organizations, facilities, and treatment centers popping up everywhere right now. It's unreal here in this particular Houston market, as well as like Dallas and Austin. And I know it's obviously been going on in Texas for a while. California. Some other thing, I'm looking to see if there's Q&As, but I wanted to say, I wanted you to do me a favor and explain, I know body brokers. I've even seen the movie. I think it was called Body Brokers. That was the exact title of it. Really tough movie to watch. But I talked to many families and even therapists that aren't really certain about what you mean. Can you give us kind of a quick idea of what a body broker is and who gets the financial gain on that? And one more part, are you still seeing a lot of that in California or in Florida? I know that's the two states where it was very prominent. Now I know it's everywhere, but define a body broker.
Well, body broker is when somebody offers to do what we all do, but for no fee, for free. And then directs that person, here's the place where you should go. Okay. And that body broker, he doesn't really know, or she know. Nonetheless, their goal is to get the commission, and the facility will then pay that body broker, that person, a commission for sending that patient there. There are two big issues about that I have. Number one, I just think it's wrong. It's just unethical as hell to send somebody to a facility and they're paying you a commission for it. My biggest issue with it is that if I'm a parent and my child is going to this facility and I find out later that person is sending my son or daughter to that facility because they're paying the highest, they won the auction, they won the contest of paying this person for that. Well, how do I know you're not sending that person there just for money as opposed to it's the best place for my son or daughter? Right. I mean, that's just plain wrong. It just is. So that's my position. I don't run into it. I had before many years ago, but you know what? Here's the thing. I know that I have confidence, and I've never done it, but I have confidence. The places where I take people, if I were to stoop that low and ask for a commission, they would tell me to take a flying, so fast, and they would be right to do so.
Yes,
so
agreed.
Don't even go there. Don't even think about it.
So patient brokering is illegal in the state of Texas, but just curious, is it illegal everywhere or is that just here?
No, no, it's not illegal. In most states, it's not legal.
That.
Well, I know in several states it is illegal, but I don't have the breakdown as to how many states it still is not. Wow. I don't know. I just stay away from it, and I never have it. Actually, it never becomes part of
what you're doing?
No, I never, very rarely see it. I
Good.
think it's because that's not the world, that I'm
Right.
in.
I think as an
Thank God.
industry, we've really come together to, prevent that, and even some self-check organizations popping up. And I'm glad you brought that up.
I do have one. I do tell people the following. I will send people to facilities if they have two of the following three certifications. Number one, they have to be certified by either the Joint Commission or CARF.
Mm-hmm.
Between the two of them, they certify over 28,000 facilities throughout the world. Okay. It takes money and it takes effort to get certified by them. And it shows that you put in the money and the effort and you have an ethical place if you are certified by them. And the second one is being a member of the NAATP, the National Association of Addiction Treatment Professionals. They are the ultimate referee. They are very, very ethical. And I know of instances where they will come down on a client when that client has done something wrong to somebody who's complaining to them. I know that. So I have a great deal of confidence in the NAATP. So NAATP and either CARF or Joint Commission, they're necessary.
Yeah. Well, and for the clients that may not have insurance, do you work with OSAR? Do you know much about the OSAR?
I don't know that, but I do know the following, and this is what I do in my book. And that is I explain, it's in the book, as far as Medicaid, as far as also getting private insurance through the ACA, but also getting treatment that doesn't cost you anything. I have in the book how you find out to get those type of treatment programs. For instance, I have in the book the chart of the FPL, the federal poverty level, because where you are in the federal poverty level in a particular state will tell you exactly what you are eligible to get in terms of insurance and in terms of the kind of care that you need. So it doesn't matter. Now, Medicare is difficult because you got to do it all through a hospital. But whether it's private pay, whether it's private insurance, whether it's Medicaid, whether it's Medicare, or whether you have nothing, I will say it's the single males in the non-expanded states, man, that's a problem. I also have that chart, okay, of the non-expanded states and it makes no sense. It drives me crazy that you want somebody to be insured, but you place such unreasonable definitions or restrictions on that family. Like I can't remember, in Alabama, I think it was, if you make over $75 a week, you don't qualify for Medicaid. I mean, it's nuts. It's not. Here's one thing I want people to realize, and that is, I hear people often say, why should I work for my money? Why should I help that person get, insurance or get anything? You know why? Because you have to look at insurance as an investment in people, because it is known, it is quantified. And also in the book, I could show you example after example where treatment, for every dollar that's spent on treatment, there's a minimum of a $4 return in a financial benefit. And that goes up to thousands of dollars. And I can tell you that because I've seen the studies, I've done the research, and in the state of Washington, they have it live on their website as to how much money they're spending on all different kinds of treatment programs and what is the beneficial return on every dollar spent. So are there going to be people who are bad actors? Of course. But are you going to compromise the whole program because of just a few jerks? No, It's an investment. And if we want a strong economy in our country, you got to have a healthy worker. And if a healthy worker, it's been proven that insurance is the way that person can get the health care he or she needs. And it also helps save hospitals, especially rural hospitals, especially in non-expansion states. The number of people who are healthy in expansion states versus non-expansion states is mind-blowing.
Yeah.
Wow.
Well, I know you cover multiple states. Just wanted to throw out for our listeners out there. In Texas, they actually have an organization called OSAR, which is through the mental health authorities for different areas, and it's separated
Right.
throughout Texas. And OSAR stands for Outreach, Screening, Assessment, and Referral. And so you could simply dial 211 and get to the OSAR. Many different cities have that. A lot of the council will have that, and that's a great.
Incredibly important that people know that information.
Good. Any more questions, Kim?
I am just so grateful that you showed up today. I learned a lot, and I'm sure everyone else did. Thank you so much for your passion and all your wisdom and research that you've put into this. And yeah, thank you. I appreciate it. Thanks.
Great topic.
Come see us in Texas, please.
It is a complicated process, and people like Kim and I, we do this as a job, just trying to keep up with all the different options and programs out there, and it is complicated.
It's a lot.
I appreciate your book helping people along with that.
Well, my point is this: is that I think I said it earlier in the presentation, and that is, I don't care whether I said it before. You live on Park Avenue or you live, on the street. There is a treatment plan for you, and if you open my book, part of the dedication is to people who do what you do. And I could never do what you do. Never. Because how do you do every day have that enthusiasm for your work, knowing that a certain percentage of people are working, they're not going to surrender. They're going to fail. Now, they may fail several times, but hopefully you do it because you want to help that person get to where he or she needs to go. So it's my hat's off to everybody, to you all, and to your colleagues, because you're doing God's work. You're doing God's work.
Amen.
Thank you so much.
And also, I just put the link in the chat. You also get it in an email tomorrow for anybody that needs CEU credits for continuing education. There's a link to our survey. Just fill that out, and you can print off your certificate. If you have any technical issues, please let me know. Well,
thank you. I appreciate it. Thanks, guys. I really appreciate it. Okay.
Thank you, Walter. Thank you, Kim. And thank you, everybody that joined us today. Have a blessed Easter weekend.
Bye-bye.
Yes.
Bye-bye.